Hi, everybody. This is Dr. Blevins with Enilda Clinic at enildaclinic.com. And today's learning video is super special because I have my good friend and I guess former colleague, but I still chat with her and get consultation from her. So kind of still colleague.
Hopefully one day colleagues again.
Yes. Dr. Eva Freed. She is a board certified lifestyle physician, and we work together in the Central Valley in Washington. And then she moved to California and I moved to Spokane, which is super sad, but she's doing amazing things there. And we were just chatting the other day about the COVID-19 virus, and she was giving me some great information and feedback and perspective from the medical side of things. And I wanted her to be able to share her thoughts with you guys who are keeping up with the emotional coping side and behavioral management side of parenting and helping to support your kids. And so thank you for being here, Dr. Freed.
And I'll clarify, not to, but I am double boarded in family medicine and lifestyle medicine. So, and I'm practicing in the community right now. So I'm sort of on the front lines, not like our hospitalists, but I'm out there.
Yeah, you are. And thank you for that clarification. Yeah. So I think the big thing that I want to start with is, what is it like to be on the front lines and in the community right now?
Yeah. Well, I think that for physicians, like for everybody else, it is changing day to day. We haven't had a major community outbreak here yet that we know of, but we are anticipating that and trying to detect it proactively. But it's become a time of kind of learning how to live with uncertainty. So that's true in my, in my home life with my family, and that's also true out there on the front lines. I think in medicine, we tend to be very used to going by protocols and triages and algorithms. And right now we are having to operate a little bit outside of those. So we're having to really rely on our clinical judgment and common sense. And hopefully we're doing a decent job of it.
I feel the same way on the mental health side. I think it's unusual for a behavioral health provider to be doing learning videos, number one, but I've even changed the theme to be giving a little bit more information than what I normally would in a learning video. Normally my learning videos are like definitions. And these for the past week, I've been trying to do one a day, but these are falling along the I say WHO, but you said the other day WHO, and I was like, I guess that's what
the World Health Organization. Yeah.
But I've always called them WHO. But they have guidelines for supporting children. And so the learning videos are really more about exemplifying how to enact those guidelines. But to get back to the medical side of things, how are the families that you're seeing in the clinics, how are they coping? Or I guess, what are their biggest concerns that you're seeing from the medical side?
Yeah, it's interesting. I will say that, first of all, I'm not seeing many of them in clinic because we are taking a very proactive approach of trying to do telemedicine as much as possible. So for people who have really acute issues where they might need a physical exam, or we think being in person is really going to be beneficial, then we have them come in with a lot of precautions. But we're trying to do things by phone as much as possible. And, it's good and it's bad. It's hard to have some of these difficult conversations when you aren't face to face with somebody. But at the same time, I'm feeling much more comfortable that I'm not unnecessarily placing people at risk. And I think families are pretty grateful for it. So the conversations that we're having are mostly really positive. I think that people have that, that stiff upper lip, and they're trying to be very cautious. They're grateful for the opportunities that they have to shelter in place, stay home, do those sorts of things. People are getting very attentive to all the things that they can do. So people are diligent with their hand sanitizers and their hand washing and staying away from things. Sometimes I think we get a little bit too focused on some of those little interventions that we can do and not focused on the kind of just stepping back from being in public. But, there's a lot of questions. There's a lot of worry. I love you. Sorry, I'm on call.
Hi, Ben. How are you?
Who's that?
We're recording.
Oh, sorry.
I don't know what you want from me. That's not a call.
How do you unlock it?
I don't know. Ask the kids. Sorry.
Pandemic life, right?
Yeah. My kids are getting more screen time this week. I'll say that for sure. Yeah, and speaking of that, I think that's the big thing that most people are struggling with is even more than the fear. It's, what do I do with these kids? My kids are now in my house 24/7, and that's really stressful. A lot of us deal with emotional issues and depression and anxiety, and I can tell you that my anxiety is through the roof when I have to be around my kids all day. I love them. It's stressful. It's a lot.
It is. It really is. Yeah. Because I think that, parents overall are doing little strategies just in normal life, but any little stressor that might be in normal life might start to be exacerbated in pandemic life.
Yeah.
And that's something that I think is very real, given that a lot of parents are going to be trying to manage working from home or being out of work or being socially isolated from their own support network. And there's just so many different dynamics that are going on. So for sure, that's definitely happening. You said something interesting a minute ago. You mentioned hand washing versus going out in public and the emphasis that people might be putting on hand washing over, or even just hand sanitizing over going out in public. Can you say more about what you mean?
I would love to say more about this. So I grew up in Portland, Oregon, and much love to all my fellow Portlandians. But we would always joke about this phenomenon that would happen in the winters. Whenever there was like an inch of snow on the ground, everybody would put chains on their tires and just go out driving like everything was normal. And they'd be tearing down the highway at 60 with the chains a-flapping. Mm-hmm. And I think that we have to keep in mind that these measures are helpful, but ultimately you have to change the way that you're driving. So it is good. If you do have to go outside of the house, wash your hands, use hand sanitizer, don't touch your face, stay 6 feet away from everybody. But if you can avoid going out of the house, then you've taken that risk reduction all the way down to 0. And that's so much more effective. So, we have to buy groceries. I don't have 3 months of food in my house, nor do I think it's a good idea to go out and buy 3 months of food. So I'm going shopping every 2 weeks. That's my goal. And I'm careful to kind of minimize contact when I'm out. I do have to do that, but I'm not going to the store every other day just because we can. Yeah, so it's changing the way that you're driving, I think, is the way that we need to approach this.
Right. Yeah, it's definitely a behavior change for sure for everybody. Although I will say I'm starting to realize that my lifestyle, normal life versus pandemic life, I don't know that there's much of a difference for me. When I talk to people, I'm like, yeah, I'm doing fine personally. My cats are thriving with mommy at home. Although I feel like I'm working really hard because I am trying to do these videos as community service. So I feel like my work situation has changed dramatically. But other than that, I don't know that I need to see people.
Yeah. Yeah.
Okay. So what about the mindset? So for me, it's hard because I don't know on the mental health side of things how to, and I'm very reluctant to speak about some of the mindset piece for thinking about the anxiety people should have. Like you just spoke a good bit about it, like having a plan for minimizing going out in public, but not being fearful about going out in public because we have excellent safety measures that we know reduce our risk dramatically, like hand washing, not touching your face, things like that. So I think all of those are great features to talk about managing anxiety. I think something that also kind of looms in my head is the fact that even if I'm only referencing the CDC or WHO, they still talk about the fact that the pandemic's going to get worse. And so in my mind, not being a physician, I don't know how to think about, like, my world has never been this way before.
Yeah.
And I don't know how to think about that or how to provide support in that sense. Like, I'm in the same position as my patients. What? Help me.
Yeah. So I had the opportunity to live abroad a few years ago in an area that had a lot of terrorist attacks and, you know, had kind of real crises coming up all the time. And it was really interesting how different people reacted there versus react here. So here we love to watch the news and get very, very excited and very overwhelmed and very like, what can I buy to deal with this thing that's coming up? And we just go from everything's copacetic to everything is crisis. And for people who deal with crisis a lot more, and you know, in countries where they do that, there's almost like a defiant normality to things. So I think when you've lived through a few more crises, you tend to realize that this too shall pass and that you still have to go on and live your life with this. I don't think I'm being very coherent right now.
You are. I think you're doing a great job. You know, I was just thinking the other day, and a lot of therapists are talking online about this, that this is a physical world situation, and we have to start delineating what we can control from what we can't control. Yeah. And I think what you're really pointing at is that we have control over our thoughts about the situation. Mm-hmm. It's about recognizing when our mentality is starting to blow up and become overwhelmed with anxiety versus when the world is actually overwhelmed, right? And like right now, I feel like the big thing that I've been impressed with is how the Americans are actually sheltering in place, and they are actually doing all these super productive things. Even, and correct me if I'm wrong, even though I think the majority of people won't actually succumb to this virus in a lethal way.
That's what we're anticipating.
Yeah, that's what we're anticipating, right? And so to me, that's such an act of compassion. And so whenever I kind of put it in that perspective, it helps me to really relax and to feel like I can have the space for generosity of spirit with my patients and with people in the community. I feel like that goes in line with what you're saying. And
yeah.
Okay.
I think that we have very real things that we can do day to day. Your actions can directly affect the health of your neighbors and the people around you. There are a lot of really good things that you can do. And, you know, I worry that some people are looking forward at this like, okay, we're getting ready for it, we're bracing for it, we're bracing for it, we're bracing for it, and then it's going to be the zombie apocalypse, and I'm going to need my survival gear and my fire starting kit and my guns. But, you know, even in Italy, which has been really, really hard hit, there's still food on the grocery store shelves. You know, people are still living in their homes, the water is running, the lights are on. You know, we're maybe preparing for the wrong thing. And if we're kind of directing our energy towards, you know, how do I set up my own little home bunker, then we're missing the opportunities to like stay home and maybe, you know, mindfully enjoy this time with your family and really focus on those things that you can do. You know, the other big thing that I'm seeing is that if I look at the news, and I'm experiencing this and I'm hearing it from my patients, if I look at the news, what do I see? I see grocery stores with all the toilet paper gone. There's no food. There's a nurse crying because after a 48-hour shift, she wasn't able to buy vegetables for her family. And if you are at home and looking at the news, then it's terrifying, right? But if you look outside your door, you're going to see something very different. You're going to see your neighbor waving at you from across the street. You're going to get a call from a friend saying, hey, I'm doing a big grocery store run. Can I bring you anything? You know, my anxiety was getting a little bit up there. And I went to the grocery store last night, and I had heard they're only having 5 people in the store at a time, and there's a line a mile long, and, you know, they're limiting how much you can buy. And I was going over there, okay, and I'm looking around, and there's people wearing gloves and touching their phones in their faces anyway, and that's another story. But I went, and the line moves quickly, and, you know, they were just limiting so that you could only have a certain number of people in the store at a time. So 5 came out, 5 went in. I spent maybe 10 minutes in line. Everybody was spaced out really nicely. The grocery store had plenty of food. I bought my, you know, my 2 weeks worth of groceries like normal. Everything that I needed was there. People were being really pleasant. Nobody was, you know, scooping all the bags of rice onto their carts. I had a lovely conversation with a woman about what kind of apples we were looking for. I had a nice short line to stand in. Everything was handled really beautifully. It was a pleasant experience, and it was very reassuring for me to see, even though I know all these things logically, to see the grocery stores open. People are being normal. This is reality, not the scary things that are being portrayed on the news. It's like a birth story. Nobody ever tells a good birth story. They're never like, oh, I had some contractions and I went in and I pushed and I had a healthy baby a couple hours later. It's always, there was a C-section and there was so much blood and the doctor was terrible. Yeah.
We only remember the dramatic things, right?
Yeah, yeah. Nobody's going to put like a pleasant grocery store trip on the news.
I had an interview with a newspaper guy yesterday, and he kept pulling for these very dramatic, like, psychological concepts. And I was like, that doesn't apply here. He just kept saying it over, and you could tell his disappointment across the conversation. And I finally was just like, I think you need to find someone else to interview. Like, there's nothing, like, I don't think that that's the situation. Like, that's because he kept asking for my personal experience. And I was like, I am seeing so much compassion, so many people coming together. Like, if you look at the companies that are putting out their resources for everybody to get through this, to really be able to do social distancing, it is amazing. I'm really proud. I know that the CDC and WHO are saying that we need to do more. And, you know, I fully buy into that and I agree. And I think that the overall reaction of us coming together to support us doing more is admirable. So yeah. And I appreciate your perspective too, because I found myself having anxiety. Like, I went to the grocery store the other day and I didn't want to talk to anybody. I couldn't have had a conversation about what type of apples I was looking for, because it would have been like, you can yell it at me from across the door. But there's just,
for the record, we maintain 6 feet of distance for that conversation.
Yeah, exactly. I mean, I was in and out of that store so fast. So I feel like for me, just something that I have to do is check in with the physiological response I'm having and recognizing that that's anxiety, and being cognizant so that I don't add to any kind of panic, right? Because that's something that's happening in my brain, but that's not something that's happening in the real world. Other people, not everybody is acting that way.
Yeah. And, you know, it's a pandemic. It's bad enough. We don't have to let it win. We don't have to make it worse by panicking and, you know, making our lives miserable.
Right.
Like we have so much power over it, me least of all.
Yeah. So I would like us to kind of take that last little bit of conversation, where I think that one was mostly targeted towards adults. Like, how do we help adults think about managing their anxiety and anticipation about an unknown future? How do we take that conversation to a kid level?
Yeah. You know, I'm probably going to speak more as a mother here than a doctor. Well, maybe a little bit as a doctor. I have difficult conversations with scary people all the time. And I think the most important thing is that you have to trust people to be able to deal with facts. And I think that that's true for children as much as it is for adults. And so the way that I've kind of looked at this, which is how I try to look at a lot of difficult conversations with my kids, is I'm going to talk about it in the same approach that I talk about sex. And so that's going to be different depending on the age of the child. But it's going to be direct. It's going to be fact-based. It's going to be honest. And if my kid asks me a question, even if it's really hard for me, I'm still going to try to answer it in an honest way.
Yeah.
And so I actually sat down, we had a big family meeting last night, and we talked about it as a family because we're very blessed to live on a beautiful neighborhood with a bunch of, other little kids on our block, and they have lots of friends, and they're always, it's normal that they can, bust out the front door, run up to their friend's house, come back. The kids are always just running around in a little pack. And right now we're under shelter in place. And so we are not doing that. And so I don't want to just yell at my kids and say, you can't go outside because I said so, right? Because I said so was never a satisfying answer and rarely effective. And so we sat down and had a conversation. And so with my younger kiddos, so I have a 3-year-old and a 4-year-old, boys, thick as thieves, those two. We had a conversation about it, and I said, it's a sickness. And I started off kind of asking them, like, what do you know about how people get sick? Have you heard the word COVID? Have you heard the word coronavirus? Have you heard about what's going on? And they were able to talk about germs, and they know, they're supposed to cover their cough. They know that they're supposed to wash their hands. They're terrible at all of this, by the way, of course.
Yeah.
And so we talked about it, and we talked about the fact that, from what we know, this is kind of like a cold, and the transmission is like a cold. So you have to cover your mouth, you have to wash your hands. We talked about the fact that most people are going to be just fine when they get this cold. But some people who are sicker or who are older are going to get really, really sick. And I did tell them some of those people may die. And that's scary. And mommy's scared about it. And you're probably going to be scared about it too. But we have some things that we can do. And then we gave examples of people that we know in our lives who might be a little bit more vulnerable. So we say, what can we do to help Mrs. C, who lives next door, who's 93, just a firecracker, I love her. Or, what can we do to help Graham stay healthy, who's 65? And then try to talk about these things in the context of how are we protecting her? So not, you better wash your hands because I don't want you to kill your grandmother, but we're going to do this so that we don't get somebody sick, so that they don't get this person that we love sick. So we're going to do this thing, and it's going to help. It's going to protect people. So you can't ride your bike up to your friend's house today, and that sucks, buddy. I'm sorry. But this is good because this is protecting people, and you're part of that.
Yeah,
and then
I like that.
I have a 6-year-old daughter who tends to be a little bit neurotic like her mother. And we were able to talk in a little bit more detail. She's like, I heard that this is because people were eating meat and it went from the animals into the people. She's a little animal rights activist. I love her. And so she had, some fairly detailed information about it. But she still didn't really quite understand kind of the nuts and bolts details. And, while I'm having these conversations, my boys are not really wanting to pay attention and not taking it seriously and saying, no, I'm going to my friends anyway. And I feel that my instinct is to be like, you're going to kill your grandmother. You got to listen to me right now. But the thing that I have learned with my kids is that sometimes you plant these little seeds and they kind of grow. And so I don't want to, say something in a scary way. And I also want to keep in mind that I'm talking about death, and I need to do that in a very small and gentle way, because 2 days from now, one of my boys will probably come back crying and say, I don't want Graham to die. And so you kind of start these ideas like in a small way. You try to be really gentle with it, try to focus on the proactive, and realize that they're probably going to get freaked out by it. And you don't have to impress all of the severity upon them right away, because it will develop.
Yeah. Yeah. So I kind of want to mention my takeaways from what you just said. I feel like, so I did a video a little bit about this the other day, and the way I was thinking about it, because this is the way we approach sex conversations in psychology world, is we kind of let the child guide the conversation, right? When the child asks a question, you just open it, or you just answer it with open, honest answers at the child's developmental level. And kind of the rule here is that you don't really go further than that. You don't need to explain more anatomy or more functions than like what the child is asking about, because oftentimes a child, for whatever age they're at, is actually only asking about that superficial question.
Yeah.
And then they will, exactly what you just said, they will take that seed of information and ponder it in their mind, and then they'll come back to you, and then they'll ask the next question when they're ready for that information.
Yeah.
But you don't necessarily want to put that new information in their brain before they're ready for it.
Yeah.
Yeah. And so in that way, the child can guide the conversation as they are processing it at their speed. And I really appreciate you taking the approach of how you think it through as a mom. And yeah, all of that was super helpful.
What was the thing that I wanted to mention?
I'm touching my face. Look at
Oh,
me.
I always say this, I use this example when it comes to office politics, when it comes to difficult conversations. All of it is analogous to these sexual health development questions. The information is out there. They're going to hear about things from somewhere, and they will probably get kind of scary or maybe misleading or maybe partial information. And so, one, they need to trust you as a reliable resource, but two, you kind of need to control the message to make sure that they are getting reliable information and they're not just getting scary stuff. Because if you're totally trying to shelter your kids from this, but they're on Facebook and talking to their friends or talking to their friends on the phone, they're going to be talking about it. So get some good information out there.
Right, for sure. Yeah, I definitely didn't mean to say that parents shouldn't talk to their kids about it. Yeah, for sure. But I think it's more about having forced conversations, like starting the conversation and then allowing the child to process it over time, gradually, how you talked about, I think is a very gentle approach. Yeah, developmentally appropriate too.
And I kind of accepted as a mother that I'm going to traumatize my kids on a probably weekly basis. It kind of comes with the territory. I'm not going to do this perfectly. We're going to have some missteps, and all I can do is learn from those.
I like that self-compassion.
Oh.
All right. Thank you so much. All of this information has been super, super helpful. So to wrap up, what would you like to say, speaking on behalf of the medical community, because you are my first and maybe the only physician I ever get to chat with on one of my learning videos. And so I want to know what your final thoughts might be for us all.
Okay. Well, I'll speak on behalf of myself. Won't make anybody else responsible for me. But, if there's one take-home message right now today, it is to be really, really proactive and aggressive about social distancing. This is the thing that we can do. This is the way that we individually can make a big change in this thing. Minimize your trips to the store. Don't go out if you can avoid it. If you have the option to work from home, even if you are in one of those critical job functions, then do that. If you need non-emergent medical care, call the clinic first or call the hospital first and see how they want you to triage. There are no absolutes in medicine. We cannot guarantee that you, for instance, Leslie Blevins, are not going to get this thing. Okay, you probably will. I don't know. We can't guarantee it 100%, but we absolutely can slow the spread, reduce the load on hospitals, and make it so that for those people who are sick, they have much, much better chance of getting the care that they need. The social distancing measures, they are for other people as much as they are for you. So make this the gift that you give to your neighbors in your community, that you really try to protect everyone. I think that there's a lot of things in parenting where we don't know exactly what the right choice is, but we have to look back. We have to be able to look back and say, I made the right decision at the time. And so I want everybody to come out of this thing, 6 months from now, and be able to look back and say, I feel good about what we did. I feel like we were proactive. I feel like, we weren't taking it too lightly. Be able to feel good about the actions and the choices that you're making right now. use social media to be social and not just to consume a lot of really scary stuff, because there's a lot of really scary stuff out there right now. And everybody's scared. So, you know, if it's that friend from high school that you haven't talked to in a little while and you're stuck at home, reach out, say, hey, you know, connect with each other. Don't just be, you know, spreading and consuming every scary little tidbit that you see. And then I just want to give a big shout out to the real heroes of all this, which is everybody who's working at the grocery store right now, because it is really comforting to know that grocery store is stocked and I can go there. You know, I'm getting a lot of thanks and gratitude from my community and my patients, you know, for doing what I do, because I think we're really visibly on the front lines. But, you know, the people who are working at the grocery store and the gas station and driving the trucks, you know, they're the ones who are really keeping the country running right now. And so, you know, I just want to express my gratitude to all of those people. And, you know, to remind people when you go to the grocery store, you know, be a little bit more diligent about your hand washing and your social distancing to try to protect those people who are there for you.
Yeah.
Yeah.
Yeah. And having patience and kindness while we're there too.
Yeah. Yeah.
And I also want to say thank you to you and to the medical profession as a whole, because you guys are working so hard and nonstop. And I know that what you guys are doing with limited supplies, you maybe at times are putting yourself at risk. And I know you guys are taking tons and tons of precautions, but you're doing that due to compassion and kindness, and it's wonderful. So thank you so much for that.
It's a privilege.
We appreciate it. Thank you for being a part of this learning video. I know that you've helped me a great deal to integrate in the medical information that has been hard to piece apart from all of the social media and the stuff that's just, you know, flooding at me every single day. And I really appreciate you taking the time to do that.
Yeah.
Yeah.
Thank you for having me.
Yeah, thank you so much. Everybody at home watching, I hope that you enjoyed this video, and I hope that you got some good information from it. And I hope that it helped you have some mind shifts that allowed you to experience more calmness and gave you a perspective that will help keep you and your family going over the next weeks and months with some peace, and gave you space to have joy and relaxation. So everybody, if you want to come back and watch more videos at enildaclinic.com, I encourage you. We will be focusing on the COVID-19 pandemic and how that affects families, parenting, and children for the next couple of weeks. And of course, I also do parenting, child behavior, and child psychology videos in general, so you can learn more about that there too. All right, bye guys.